Thank you so much, Jamie, Lisa and Gemma, for that presentation. Now you're staying on the screen with us as we go straight into our roundtable. We are going to delve deeper into those strategies for enhancing wellbeing in the workplace, looking at effective methods for implementing this and sharing a case study or two as well. Now, John Wilkes, our CEO, will host this event. I just want to introduce all of our speakers and send apologies from Jacqui McBurnie, who was joining us today, but it seems she's unable to at this current moment in time. Hopefully she'll come on a little bit later. But we are joined on the panel by Adam Campbell, CEO of Hapstar, who's also sponsoring today's conference and also is providing access to IHSCM members to the platform as well from 1st of June. Now, Hapstar is a powerful platform for managing wellbeing, employee wellbeing and personal wellbeing, and we'll have an event on the 4th of June where members can set some goals and experience the platform for themselves. So, Adam, thank you so much for joining us today. We are also joined later on by Jacqui McBurnie, who is founder and former chair of NHS England's Menopause Network. She will be joining us. And we are joined again by Jamie Humphrey, CEO and co-founder of ReechUs Wellbeing, Lisa LLoyd, chartered psychologist, psychotherapist and founder of It's Time for Change. And last but not least, Gemma Ellison, who is also founder of Heart Leadership. Thank you so much, everybody. Over to you, John.
Thank you, Jade. Hello, everybody on screen. I think it's probably important to start this off to try to quantify why this topic of well-being is so important to us. And just to sort of set the scene, you know, we can't be surprised that we have 130,000 vacancies across NHS, 160,000 across social care, by the way. You know, these are consequences, I would suggest to you all, of a refusal to acknowledge that well-being, thoughtfulness, compassion is an effective means by which we can run and lead organisations. I wonder if any of you might like to start by trying to help us quantify what's the effect of well-being. Why should any leader worth their salt be willing to crawl naked over broken glass in order to enhance it? Who'd like to start? I don't mind. Yeah, go for it, Adam.
It's a question that we get asked a lot of where do we draw the line? Whose responsibility is well-being? Why should I, as a business leader or a business owner or whatever that might be, actually care about the well-being of my people and want to do something for it? And I don't think anyone's necessarily denying that there is positive benefit of people being happy and healthy and able to come into work feeling positive and to be able to do the job from that positive perspective. I think where we start to come a bit unstuck is how do we get people to actually understand well-being, to be motivated to look after their own well-being, to take part in the types of initiatives and things that a business might put in place? Because where companies might have best intentions for it, a lot of the time the engagement can be low, or people might not necessarily be getting involved when it may be in their best interest. And that's a lot of the bridge that we have to try and cross. I think when we're just looking at it as a whole of what is the reason behind doing it, I don't think the jury's necessarily out. I think a lot of these companies do want to, but perhaps there has been reluctance in the past for people to get involved. And it's almost seen as it's been not necessarily appreciated in the businesses that have tried it. I think what the guys were saying earlier about the good, the great and the ugly is that some companies are doing the right things, but those engagement pieces are low. And so we have to work on educating and inspiring people to take part in well-being for the initiatives to actually work effectively.
I wonder whether... Go ahead, Gemma, go on.
No, I just wanted to just to sort of come back to one of Adam's points there. I wonder whether it's not taken as seriously because we think about it as an initiative. This should be day to day. This should be embedded within our culture and within our environment. When we think of things as initiatives, they seem to have a time limit on them. If I think of a new initiative, I think it's going to start then, it's going to end then, it's a bit of a campaign. But actually, this should be something that is embedded within how we go about our lives in organisations. So I wonder whether that's something to think about.
Can I also just add that I think for some leaders and managers, there's a real disconnect between what they think about as high performance and mental health and wellbeing. And so I haven't got time to do all that kind of wellbeing stuff because that's the nice to have, and that's not really my job. My job is to motivate my team and to make sure we're meeting our targets and to make sure they're performing really, really well. And they don't understand the connection between performance and, we can't perform well if we're not in a good emotional state. And so sometimes I will, the language is really important. So if I'm talking to a group of people who are quite anti-wellbeing, but they're really into performance, we'll talk about performance. And it always circles back to, this is how your brain works. And this is, you take them on the journey from the end back to the start. And they're like, oh, now I get it.
Well, if I might, but do they? I mean, there is a reason we've got 44.8% of NHS staff in the last year have reported work-related stress illness. So I would suggest to you that, we're probably preaching to the converts on a call like this, because people who are going to be on this conference are probably people who care passionately about well-being and understand its importance. But there must be swathes of managers and leaders across health and social care that simply reject this as a philosophy for exciting high performance.
Or
Jamie,
they feel stuck.
Or maybe so, or maybe they've never been shown how to lead with well-being at the forefront of that. But I get frustrated, I suppose, because there's plenty of resources available, to help people to promote well-being and so on. I mean, we're awash with them. Every major NHS organisation has some type of well-being resources available to staff, and they work really hard at encouraging staff to use them and visit them. So why, therefore, do we continue to have such a plague of poor behaviour that isn't complete rejection of well-being principles? Jamie, would you like to comment?
Yeah, it's a bit of a quandary, isn't it? Because we all want to get healthier. All of us do. Everyone wants to be as healthy as possible. We don't want to struggle. We want to feel good. We want to feel amazing. It's just about, how do we get there? What are the specific obstacles that are stopping us from reaching that point? And I guess it's a question like you guys were just saying, are managers equipped to be able to, one, identify the obstacles that are stopping the individuals below them from getting healthier, and then two, knock down those obstacles or provide whatever it is they need to be able to make those steps.
And a lot of the managers we see aren't given the time or permission to do that. So a lot of managers we're working with have really good intentions and they know all the resources are there. They simply don't have the time to do the people aspect of their role because they're too busy doing all the other stuff.
So Lisa, who or what is denying them the opportunity to develop the skills and aptitudes that research tells us will have a positive effect on performance? Is that a top of the tree cultural thing where we've just got so ingrained with the idea of performance right from the top, Secretary of State down, that actually reinventing this from the bottom up is next to impossible? Is that what we're suggesting?
We need to work with the leaders. We have someone from the NHS on one of our labs, and so we have an interesting insight into what she's trying to do. But I think we can have managers who are trying really, really hard to do what they need to do for their team. But if that manager's under huge pressure and they're feeling the pressure themselves to deliver what they need to deliver, it goes up the chain. So ultimately, it's that's where we're trying to work with the leadership level, which is about creating the space to say, actually, we need to prioritize the mental health and wellbeing, but this is how we're going to do it. We're going to expect you to spend this amount of time each week on activities that are about improving wellbeing and making sure that those activities are matching the needs of the workforce. So actually that they are relevant. And so lots of organizations we see are doing great things like Fruit Fridays and yoga at lunch and so on, which is great and certainly has a place. I'm not knocking that, but actually if someone feels that they are so overwhelmed with their workload that they can't access that, then that's a barrier that needs to be looked at.
All right, thank you.
In my opinion.
Thank you, Lisa. No, that's fine. This is about opinions. This is a round table. Gemma, would you like to comment?
Yeah, I think I'd look even wider, really, and just think culturally what's going on a societal level. I think I was certainly raised with the sort of mentality that you need to put all the graft in, you need to work really hard. It's down to things like, I need to go to school unless I'm on my deathbed and all this kind of thing. And that's what you see in organisations now. I think there's a little bit of a change happening for me post-COVID. I'm seeing more people who are willing to walk away from positions that don't serve them. That could be why there's so many vacancies, why people are going off sick. They're putting themselves first and think, I'm not going to tolerate this anymore. But I do see a bit of a change in terms of we've got new generations coming into the workforce, people who are more likely and willing to say, I'm not going to put up with this anymore. I've got needs and I'm going to put them first. I am going to make sure that I don't work all of these hours. But I'm in that strange place where I can see it from both sides. But I think there's an again, I don't know if it's us just societally. I think there's something that we need to think about how we educate people around us, how we speak at home, in our families, how we talk to our kids, because they're going to be the future of the workforce. But I do definitely see a world, but again, look, particularly my background is in the legal industry. I'm seeing people leave their jobs without jobs to go to because they're saying, I'm not doing it anymore. It's a little bit of in terms of the industries, social care, health and social care, legal, the ridiculous hours people have to work, the fact that you've got to put everyone's needs before your own. I'm now starting to see a difference in people standing up and saying, sorry, not for me.
Yeah,
I'd rather go work in a coffee shop.
if I could put an alternative view, Gemma, I'll play devil's advocate here.
Okay.
I've got no problem with working hard. I've got no problem with working long hours and so on. But ultimately, people will get burnt out if they're being forced to undertake that. So by insisting on that as the modus operandi from a leadership perspective, we are actually denuding our workforce of talent because they're doing exactly what you say. They're walking away from it. It's not because the job can't be done well. It's because we've got leaders who refuse to acknowledge that there is a better way of encouraging their people to high performance. And actually, if those leaders listened and were more thoughtful and empathetic and compassionate, they would get the performance that they're looking for and they would keep their people.
Yeah, I couldn't agree more. And again, there's no doubt in my mind that people are able to do a job. I was a national award-winning lawyer who suffered burnout and then said, no more, thank you very much. There's no doubt in my ability, but I wasn't going to stand for it anymore. Right. And it was, again, a leadership issue. So I think you're right. When leaders and organizations are prioritizing profit and sort of, an unrealistic and unhealthy working environment, this is why our point is on environment. You might have one leader, for example, who wants to do it in the right way. If they come across 9 on their board who are saying absolutely not, who's going to win? This is an environmental thing in organisations, which is why we have to get to the root cause of that. We say this is about leadership, having to do something else from the very top. We have to have a different approach to what we consider to be a healthy and inspiring performance environment. And back to Lisa's point, high performance, yeah, we want, I don't doubt people want to do their best work. People don't go into the profession like health and social care because they can't be bothered. They're coming there because they want to do the right work in the best way for the people who they care for. So I think that that's where there needs to be the change. I think it's a bigger change that we need to see more sort of systematically.
All right, so I'm getting the message from Lisa and Gemma that there needs to be a tidal turn in respect of the leadership approach to well-being and an acknowledgement that playing the tough guy or girl doesn't necessarily provide a sustainable high performance environment in which people can thrive and deliver their very best performances. Jamie, I'm interested, we referred a little while ago about the fact that I think every NHS organisation, and I would suspect the majority of social care provider organisations, have some type of well-being programme or resource capability where they can direct people and so on and encourage people to participate. But the take-up is really low when you go and talk to people responsible for these schemes. Have you any thoughts on how we might address that?
I mean, I can answer this quite easily. My sister's a nurse. She works for the NHS, and I asked her before this call. I said, "What have you got access to that will improve your well-being via the NHS?" And she just stared at me. Now, she does have something. There has to be something, but there's no awareness there. Now, so a lack of awareness is one thing. Another thing is the stuff that these guys have access to actually relevant? Like to Lisa's point, is this addressing the obstacles that they're currently facing that are stopping them from getting healthy? So I guess it's a question of specificity, and awareness is two pretty high things, I guess.
Thank you. Adam, would you like to comment?
Yeah, absolutely.
I'm conscious of the fact that we're bringing Hapstar in for our members. Odds on, if we can't answer this question in an effective manner, it'll be a lovely thing that we make available, but actually the take up is, in single figures.
Engagement is one of the biggest factors when people are considering what to bring in around well-being. The biggest question we ever get asked is, how many people will use it? Is what everyone tends to look at, because it's the area that companies have normally struggled with the most, is getting people to do something. And it comes down to, just why do we do anything as humans, as people? Why do we go places? Why do we do things? Why do we buy things? And it's never just completely by accident. I used to be a personal trainer, and nobody wandered into the gym window shopping thinking, I might get some personal training. There's a reason they went there in the first place. They weren't fit enough to play with the kids. They didn't like what they saw in the mirror. There was something, there was a reason. And so I would always ask, what's your why? Why are you here? And whenever we did sessions, I would remind them of that reason for being there. A lot of the times when companies, organizations, whoever they might be, when they implement any kind of initiative or any kind of solution or any kind of entire culture change around well-being, where there's something that people can get involved with, if it's just given to you without you understanding why it makes a difference to your life, why you would engage with it, what impact will it have on you, you're not going to do it. If I said to someone, meditating's great, try meditating, they might do it for a couple of days, not really understand the benefit or whatever that might be, and they'll stop. If someone came to me and said, I get home from work and I'm so stressed, I can't be bothered to play with my kids, or I am angry at my partner, or whatever that might be, and I said, well, if that's the thing you want to change in your life, and taking 5 minutes before you go in the house to just do something that will help you calm down, to leave that stress at the door and go, and that motivation, that why, might get them to engage in that type of process. But I don't think people necessarily are having that education around what impact will these things that we're providing for you have on your life? What specific to you will this do for you? And then how can you utilize this in that way? To them, it's just a thing that is something positive around well-being, but it has to be shown to be impactful for them as an individual.
Yeah, I suppose it's the kind of community library syndrome. We've got all these community libraries around the country, but all the stats tell us that large portions of the community no longer use them, or have never even been into them, because they choose to access education and learning in a completely different manner these days. So I get that completely. Gemma, would you like to comment?
Yeah, I think so. Just picking up on something that Adam just said there, I wonder whether on occasion, again, I know people who've got lots of access to lots of resources, and they have lots of wellbeing support available. There are programs for different things. Sometimes that in itself can be overwhelming. And when we think about, so it's just to your point there, Adam, about can you take those 5 minutes? It's about starting small. Again, I talked earlier about what's your 1%. How can you do one thing differently every day? So how can we make it more simple for people to access? How can we make it easier? How can we take the decisions? Because again, if someone's stressed and overwhelmed, the last thing you need is to think, right, I've got 40 resources here I could choose from. You're immediately going to think, no, so how can we encourage people, to Adam's point about doing small things, because those small things will then accumulate into bigger things, and when they are small, that's easier to form into a habit. So that's the sort of first point. But then I wonder whether, in terms of increasing engagement, one of the things that I've always found is there's sometimes a big difference in what managers, for example, or leaders say they want their people to do and what they measure them on. And the example being, if you're having a one-to-one, but your boss is saying to you in every team meeting, prioritize well-being, prioritize having breaks, prioritize accessing this initiative. But then when it comes to sort of your one-to-one, they're like, right, how's your performance? What are your stats? What is this? And you don't talk then about the well-being element of things. So I've always thought sort of what gets measured gets done. So I wonder whether if trusts or organizations were sort of trying to put a number on it and committing to it as a group to say, look, this is where we want to get to with the engagement in this. Sometimes actually doing that makes people do it, and that's a good starting point.
Yeah,
Can
I mean,
I
we've
just
got.
add to that?
Yes, go ahead, Lisa.
Sorry,
yes,
no, because I'm just
please.
picking up on a comment that has been made in the chat from Helen, who's talking about personality traits. So you might also have people who are perfectionists, or she spoke about like being traditionally high performer. So it's really hard to prioritize health and well-being. And it's and I think that goes back to what Gemma was just saying. It makes it much easier when you've got peers support. So when you've got almost holding you to account in terms of, have you done whatever, accessing whatever resource, or have you taken some time to look after your well-being state, and actually having those conversations within teams with your peers. But that goes back to the point that's being made around, it has to be prioritized. It has to be that conversation has to be normalized around how are we looking after our well-being, and what's getting in the way of it for me today or for my team today, and what do we do about that collectively? And so maybe shifting some of the onus from individuals into a kind of collective working as a team, because I think with peer support it makes it much easier, and that's all about creating that feeling of psychological safety where people can be authentic, they can be vulnerable, and they can say, this is I really want to try my best. High performers often get rewarded. It's like Gemma was saying about winning awards and stuff, get rewarded for, well done for meeting your targets, well done for excelling again, keep it up. And it's like, actually, but that's coming at a cost, because that person's not necessarily prioritizing their well-being. So it goes back to that point of, what are we recognizing, what are we rewarding?
Okay, I'll just make an observation then. So we quite rightly mandate now quite a lot of training across NHS and social care. We mandate specific things like nursing skills, understandably, through the auspices of the Royal College of Nursing and Midwifery. We clearly audit and mandate skills for doctors and clinicians and so on across their specific therapeutic disciplines and so on. And yet we give thousands of people within health and social care responsibility for leadership without any mandated training or skills acquisition. Why do we think that we're therefore magically going to achieve some kind of professional high standard in respect of leadership?
How long have we got here, John? Let's go.
I'm just wondering, I'm looking at it and thinking, I mean, this is just obvious to anybody. So why are we not mandating that people who are given responsibility for leading others receive some type of nationally approved, excellent leadership awareness? And part of that will be the importance of well-being.
And part of that's just about being a good human being, like being able to have empathy and compassion, being a compassionate leader, being able to communicate with emotional intelligence, all the kind of human stuff that makes it possible for people to have the conversations they need and to look after each other within a context of space and so on. But that's the stuff.
Don't worry, we get all the stuff that should be in the course. Don't worry. I'm just asking why is that not mandated? Why have we got into a situation where there's probably, there's 1.3 million people who work in the NHS. Let's assume there's about 50 or 60,000 who've probably got some kind of senior management leadership responsibility. There's absolutely no mandated, standard, consistent training across the piece at all.
No, I think the problem is, I don't think it's recognised as a skill set that it is. I think it just seems to be, if you're a brilliant doctor or you're a brilliant nurse, of course you're going to be able to deal with people or manage people, and there's not enough respect for it being a completely different skill set. So, you know, we're not born knowing how to give feedback on poor performance or anything like that. It needs to be taught. There needs to be conversations. And it's, look, this is a really common thing. I gave some data earlier on in our talk about there's 82% of people who are in management positions who've had no training. And that's not just unfortunate for the people who they're managing. How does it feel for them? They're being put in situations every day. Imagine asking someone to go and do perform heart surgery without being trained to do it. You know, we increase people's capability in the technical space, but actually we're really missing an attitude towards the skill set that leadership is. So I can't answer your question, John, as to why it's not mandated. I think it should be, and that's sort of the work that Lisa and I are really passionate about, working with teams and making these things happen. But I mean, I'd have to say I agree. It should be mandated. It should be something that is from someone going into an entry level position as a manager right up to the top, I think. And look, I won't get controversial, but let's be real. There are lots of people in lots of high positions that probably could do with some leadership training. That's mandatory as well. I think the world needs better leaders.
Well, amen to that. Would you like to join my tribe, Gemma? And you know, we ride at dawn in this regard.
We're riding at dawn, John. I'm ready. Let's go.
Riding at dawn. You can come with me. You can come with me.
Thanks.
Would anybody else like to comment? It just seems to be an unsaid thing. I mean, you know, tragically, you know, yesterday was the issuing of the infected blood scandal, and you know that report is littered with recommendations to do with inadequacies around leadership and tolerance of cover up and all the sorts of toxic, you know, corrosive behaviours that, you know, has led to that national scandal that will end up costing the NHS or the country at least £10 billion. Well, this has been going on for years and years and years. It keeps happening. The scandals keep occurring. The reports, the commissions, the independent inquiries keep happening. At the root of this continues to be the standard abilities and skills of leadership. And in particular, the effect that, I mean, we're talking about well-being, but it's no surprise to me that these things keep happening if we do not address this issue of leadership competence. By the way, I don't think it's about the matter of having a register. I just think it's about taking the issue of leadership nationally seriously. And if we're going to do that, then we need to train it appropriately. All right, I'm going. That's you're in my tribe now, Gemma. You'll get this as we're riding along tomorrow morning from about 5:30. Jamie, would you like to comment at all?
I guess the issue here is that, well, for something as drastic a change as this, maybe we need first evidence of how badly it can go wrong. And some of the examples that you've just spoken about there can be used to be like, do you know what? This is something that we really, really need. Evidence ABC over the last 50 years. So perhaps we're just getting to the boiling point where something significant is going to come off the back of it. But it's going to take people like Lisa and Gemma, the type of people that understand this stuff way better than I do, pushing the importance of leadership for us to get anywhere.
I think just to add,
would you like to comment? Yeah, go ahead.
Absolutely, it's something that is relatively recent. When we talk about well-being, mental health in the workplace, things like that, although we are learning very quickly, and COVID, I think, very much fast-tracked a lot of what we've been looking at because people panic bought like loo roll. There was a lot of innovation. There was a lot of new thoughts coming through, a lot of talk around this topic, which meant that people did start to put a spotlight on it. But it is relatively recent. And so if we look at the workplace over the last 150 years, whatever, it's gone from industrial revolution where you could just throw people in machinery and if they died, they died. That's absolutely fine. All the way through to health and safety. We should probably put hard hats and harnesses on people climbing up tall buildings. It's like none of this was there for a while, and it just progressed to the point where, you know, it's wrong for you to get injured in the workplace. It's wrong for us to put you in a room with asbestos and physically harm you. Managers know all of this stuff now, and it's going to progress to the point where it's wrong for us to create environments where it creates stress and burnout and has a negative impact on your mental health and well-being. And it will, in my opinion, at some point become compulsory that there is regulation around this. And how do we create those kind of environments that is conducive towards good mental health, and almost mental health and safety, where people have the training on how to understand these types of concepts and what to do around it, and then be able to promote it in the right way. But I think it's going to take a little bit of time, because, like Jamie just said, the stories of it going wrong are starting to come through more and more. And we can see from the data that things are actually getting worse rather than better. So there has to be something, like you said, John, at that top level, mandating this type of training for leaders, for people in businesses. And there has to be an incentive for them to want to do it as well as to be able to do it.
We don't have to wait for that time, do we? So this is why, you know, when we talk to organizations, we say, all right, don't do anything with it. Let's see how you're faring up in sort of 10 years time. Actually, people can start now. I agree with you, Adam. I think there will be a change. I think it will be mandated. I think this is going to be taken very seriously. It's already, you know, in countries like Australia, they talk about there's a sort of a need for psychological safety that's imposed on organizations. That's what happens. It'll end up being the same over here. But I think, why not start now? Why not be the company that puts the hand up, or the trust, or the team, or whoever, and says, okay, I'm going to prioritize this now. I'm not going to wait until it finally trickles through and gets there to sort of 4, 5, 6 years time. Actually, let's do it now. Let's start doing the right things now. And I think that when we did our good, great and ugly before, we are seeing some great organizations and great teams who are putting their hands up and going, no, let's do it now. So, you know, not everybody is in the sort of same space. Of course, if 82% of managers haven't been trained, there are 18% who have. So there are people who are doing it. We just need to make sure those numbers are going in the right direction.
Well, I agree with everything everybody said, I suppose. I just look at the last year's NHS annual staff survey and look at the percentage of people who feel engaged with what their organisation is trying to do, the percentage of people who would recommend patients to actually receive care from their organisation, and so on, the number of people who've expressed bullying and intimidation in the last year. You know, all of these, you know, it's just a horror story of neglect, where this issue of well-being simply not being put at any kind of a priority level. And I suppose let's just change the dial a little bit, because we're probably all getting a little bit weary and kind of down in the dumps about kind of the stuff that I've been going on about. Let's move the dial and say, all right, so where is it going well? Have we got some examples of organizations, big or small, where well-being's been taken seriously, training has been undertaken, encouragement has been undertaken, and it's had a really positive outcome for either the people that they serve and or the people that work within? Can any of you give any succor to this, I wonder?
I can. Yeah, I was talking to an organization a couple of weeks ago, 130 employees, very decentralized. So there's some doing manufacturing stuff, some doing sales, some doing other bits and pieces. And I spoke to their point person in wellbeing, who happened to be their HR manager, and I asked her lots of questions about their wellbeing program, and she had answers for everything. She had a schedule, she had a diary for specific events. She knew exactly what was being offered. She could answer questions about engagement and how their employees were being told about these initiatives. She had numbers for me. She knew everything. And the way she was talking about her organization was so positive. The way she was talking about her leaders was so positive. So it was a really refreshing conversation for me to have, because normally when I start this conversation with an organization, I say, okay, so what's going on with the wellbeing program? Like, what are you guys offering? And they'll sort of stare at me for a couple of seconds and hesitate and fidget for a bit, and then they'll say EAP. And so to have a conversation with an organization like this was amazing. So not only are they getting it right, but you can see how much she loved her organization and her leaders for it. So there are companies out there that are doing a really good job.
Okay, thank you, Jamie.
a good example, well, there's quite a few companies that we work with that are doing things really well, and probably the reason why they're working with us is because.
Could I just? I'm sorry to interrupt you, Adam. What have you got something specific to health and social care? I wonder.
Trying to think, like, really good examples of the types of businesses that we work with. We work with East England Ambulance Service, for example.
Okay, perfect.
Yeah, they've actually helped us to design certain features within Hapstar to better support their teams. Now, paramedics obviously have incredibly difficult jobs and very traumatizing at times. And so one of the big things that they're very concerned about is making sure that people have access to the right signposting, the right resources at the time when they need it most, and they know exactly where to go. If you've had a traumatic incident on your shift and you feel like you need to speak about it, you need to deal with it, having the opportunity with the resources that you need at that moment is vital. And I think what a lot of people, and me certainly, I do this as well, do, is when you have something going on with yourself mentally, if I'm struggling with something, if I wake up for a few days in a row and I just don't feel right, or I'm stressed or I'm sad, I could actually just not do anything about it. And a lot of people do this. Nobody would walk around with a broken leg. If you break your leg, you go to A&E. But when it comes to mental health, when it comes to trauma, when it comes to things like that, they can just kind of push it down and just carry on. And so one thing that the East England Ambulance Service is doing really, really well is making sure that when things happen, people are signposted to where they need to be. There's functions within Hapstar that they've helped develop that give people that help there and then, that make sure that they know they have a voice. They can go and speak to people. They can go and get the help that they need. And I think that's absolutely vital. No, and Gemma raised this point earlier, actually. It's like when there are too many things, you don't know which to choose from. And it's just, and we know this with our physical health. If I have a headache, I go get paracetamol. If I've got chest pain, I'll go to my GP or I'll go to A&E. If I break my leg, I'll go to A&E. I know what to do. What we need to be able to make sure that people are doing, and what some of our clients do very effectively, is say, when X happens, this is where you need to go. And Hapstar is a great route for us to be able to do this. But a good example I was going to give of companies just generally doing things well is when well-being is a central part of the conversation. And it absolutely has to be from the top. We have a client, it's about 250 person company, and the first Monday of every month, the chief exec does a talk to the whole company about what's going on in the business. And where normally in a lot of business, it would be, here's our revenue for the month, and here's how we're doing, and here's what we're doing in terms of business performance. The first thing they talk about is what's going on with well-being. What are the comments we've been receiving? What's the feedback we've been getting? How are you guys doing across different core pillars, which is the data coming through Hapstar? And what are we doing about it as a business? And their engagement levels are extremely high. It's really, really good. It's a massive success story because people feel heard. They feel listened to. It's just part of the culture. We talk about well-being here. If we're not feeling okay, we can talk about it through this platform. We can talk to our managers and we'll be listened to. And it's not a, okay, something's gone wrong, go and fix it, go over there. We don't want to have this involved as part of the conversation. Let's all discuss it, either anonymously, privately, however it wants to be, but it's okay to do that. And I think they've been a really good example of, if it's spoken about openly, if it's transparent within the business, and if leadership are talking about it as though it's a core central part of the business function, that's when it starts to become cultural and it's not just an initiative anymore.
No, perfectly said. I like that. Lisa, would you like to add in any examples of your own?
Yeah, well, I was just going to go back to, it's fresh in my mind because we were literally running one of our leader labs this morning, but you've got, when it gets built on what Adam was saying about having that space to have the conversations that need to happen and normalizing those. And when leaders are intentionally prioritizing a couple of hours a month to say, actually, I need to sit down with a group of other people who are intentionally trying to do the same stuff in terms of helping myself feel better and help my teams feel better. People come, they cry, they talk about whatever's going on for them. They take their mask off and they are very vulnerable and they talk about the real challenges for them. They then leave with at the end, when everyone was talking today about evaluating what they've got from the lab, they all said, well, I'm going away with a solution to a problem I have. And that makes me, that's taken a weight off my shoulders. We talk about rucksacks and carrying around all this stuff and they get really heavy after a while. And actually, I've taken something out of my rucksack. I've now taken off a bit of weight off my shoulders. I've got a strategy. I've got a resource I can go and take back to my team. I think I said earlier, we were talking about stress mapping this morning. They're going and using stress maps with their teams to talk about what is causing you stress. this week, and they're like, actually that empowers me to have the conversations I need to have with my teams, because I don't feel like an expert, so I don't know how to bring up this conversation. So we're giving them the framework that they need, and that takes the pressure off them as a leader, and it opens up the conversation for their teams.
Thank you, Lise. Jamie, anything from you?
I guess the reason that I got into this space in the first place was because I was chatting away to I was also a personal trainer like Adam back in the day, and chatting away to a client of mine, and he said, I've never paid for personal training. Said,
can I just ask, if you become a personal trainer, do you always end up looking like you two?
Yes.
Is that a thing?
Eventually, yes.
Is that a thing?
Yeah. I used to look like a hippie, long hair, very, very slim.
Just like an identikit, that's all.
This is all we own now is black t-shirts.
Sorry to interrupt. It just seemed like an obvious link to have to make there. So.
No problem. So basically, I was having a chat with the client. He said, look, I've never paid for personal training before. I said, what do you mean? He said, his organization pays every quarter for him to be able to spend some money on something well-being related. Now, I realize that not a lot of organizations are able to do this. It's a costly thing, but he was using it to get personal training, which was helping his brain, helping his body. It was making a massive difference to how he showed up at work. And so I kind of got interested, and I started asking him about other initiatives that he had, and he knew everything. He knew everything they were offering, everything they were doing. And to Adam's point, he knew why. And that was the biggie. I think that's the thing that organizations need to get better at, is explaining the why for every single thing that they're doing that is related to well-being. If you nail the why, people will engage with it because they understand the point of engaging with it.
I guess the other thing is it's interesting how often you use the word cost there. And I suppose if it's just regarded as a cost, then one forgets that that there should be a return on that investment. And if we're able to, it's kind of why I began at the beginning about trying to quantify the effect of a lack of well-being, or even quantifying the effect of a positive approach to well-being. Clearly it costs to engage a personal trainer, but if the benefits of that outweigh the cost, well, why wouldn't you make that investment?
There's a lot of research on this now, and yeah, there's a lot of, because we've been in this well-being bubble now for a little while. We've got some data wrapped up in the effect of different types of investments and different types of programs. And generally, the trend shows that the more that is invested, and the more time, resources, and personnel that is invested in the well-being program, the more of a return you get. So if it is kind of poorly executed, my kind of tick box well-being program, generally speaking, the return on investment is terrible. So you're paying money, but you're getting nothing back. The more people put into it, doesn't just need to be money. Generally, the better the return. So it's definitely worth doing.
All right, thank you. And Gemma, I haven't given you the opportunity to put your own case study forward. Better make it a good one. You're the last one, Don't blow this.
Oh, tell you what, this is pressure. This is pressure. No, I think the best organisations that I see, and I'll talk about it more generally, like we said earlier on, are people who make it day to day and people who actually role model this stuff. It's all well and good saying it and saying you need to prioritise this, but if I'm someone who's sitting there as a leader and I'm not coming up for air, I'm not taking a lunch, I'm not going for a walk, it's not about, it's sort of do as I say, not as I do. We need to make sure that we are role modeling it. So just to say, the best organisations that I see are actually living and breathing this stuff from leadership level down, and I think that's something that we need to really keep in mind.
Yeah, there's an authenticity to it, to paraphrase you. Yeah, I like that. Okay, well, look, we are just about out of time. I do hope you've enjoyed that, those of you who were listening in. We've got a couple of minutes if anybody would like to make any specific comment. I'm just looking here. And Judy, by the way, I didn't joke about the register. I'm a bit concerned about the idea of registering people. I just think it has to come from here, If it comes from here, we've got a chance. And I think
John, can I say?
Yeah, go ahead.
Yeah, it's John Glenn. Yeah, I'm just saying something Adam said was really very through me having worked for 56 years full time, 40 years in the NHS, Wellbeing's new. It's evolved like health and safety evolved over those 56 years. When I first started work, they gave somebody a cigarette if they'd had an accident because he, yeah, and that was the way. You look at all the old pictures on people coming out of mines. They're giving them a fag. Health and safety evolved over those 56 years, and Wellbeing's just started to hit the mark now in the last. I only retired, 3 years ago, and it was just still coming in to fashion, if you like, then. I was sent on leadership, leadership learning sets from John Moores University. That was new then, but that was done voluntarily, not mandatorily, but I did it because it seemed like a good idea at the time. But that's just my comment on how interesting for somebody who's no longer working, listening to you people who are sorting things out now, the new things
right in the mix
that have always been there, but they've not been addressed previously.
All right, we are bang out of time. Thank you, John, for that intervention. Always great to have you on our calls. By the way, John is chair of our retired members special interest group. If any of you are approaching retirement anytime soon, I'm sure he'd love to hear from you. We've got Kate says, here at Social Care Wales, our definition of well-being is our well-being at work covers every part of our working life. I won't read the whole lot out, we'll be here some time, but I like that, Kate. I think that, again, it's there's an authenticity, there's a demonstrable sincerity to that, and I think that's the refreshing part of it.